mental retardation. Introduction. In this study session, we are going to consider in details one of the exceptionalities earlier mentioned in study session 1, mental retardation. Therefore, the emphasis of the present study session will be on the meaning of mental retardation, causes, characteristics, classifications of educational programs for the mentally retarded, and the prevention of mental retardation. When you have studied this session, you should be able to 1. Define the term mental retardation, 2. Highlight the causes of mental retardation, 3. Point out the characteristics of persons with mental retardation, 4. Classify mental retardation, 5. Discuss some educational programs available for persons with mental retardation, and 6. Highlight ways by which mental retardation can be prevented. The meaning and prevalence of mental retardation. Some children are clearly and consistently performing below their age groups in many areas of endeavor: academic, social, language, and self-care skills. This deficiency is obvious to anyone who interacts with them, and this calls for special education and related services to help them realize their potentials. These children experience pervasive and substantial limitations in all or most areas of development and functioning. But this group is only a small proportion of the total population of persons with mental retardation. The largest segment consists of school-age children with mild mental retardation. Many definitions of mental retardation have been adopted and contested over the years. Among these definitions, we shall consider some for your understanding. Edgar Doll defined mental retardation using 6 criteria that must be met before an individual can be classified as having mental retardation. These are: 1. Mental subnormality, 2. Social incompetence, 3. Retarded at birth or early in life, 4. Retarded as a result of constitutional origin, 5. Retarded at maturity and must be, 6. Retardation is essentially incurable. Treadgold stated that mental retardation is a state of incomplete mental development of such a kind and degree that an individual is incapable of adapting himself or herself to the normal environment of his or her peers so as to maintain independence or control or external support. Grossman, 1983, noted that mental retardation refers to significantly sub-average general intellectual functioning resulting in or associated with deficit in adaptive behavior and manifested during the developmental period. AAMR 1992 stated that mental retardation refers to substantial limitations in present functioning. It is characterized by significantly sub-average intellectual functioning existing concurrently with related limitations in two or more of the following applicable adaptive skill areas: communication, self-care, home living, social skills, community use, self-direction, health and safety, functional academics, leisure and work. AAMR 2002 also stated that mental retardation is a disability characterized by significant limitations in both intellectual functioning and conceptual, social, and practical adaptive skills. This disability originates before age 18. Prevalence of mental retardation. Not much research has been done in Nigeria to substantiate claim, but in the US, the population of persons with mental retardation was estimated to be about 3% of the general population. According to US Department of Education 2002, during the 2000-2001 school year, 878 students ages 6 through 21 received special education under the disability category of mental retardation. These students, according to USDE, represented 10.6% of all school-age children in special education, or about 1% of the total school-age population. Mental retardation is the third largest disability category after learning disabilities and speech or language impairment. Causes of mental retardation. Causes of mental retardation can be grouped for easy understanding under three major subheadings: prenatal, perinatal, and postnatal. A. Prenatal causes, or you say before birth. Chromosomal disorders, for example, Down syndrome, Fragile syndrome, Turner's syndrome, Klinefelter syndrome. Malnutrition by mother, excessive exposure to X-ray, metabolic errors, for example, phenylketonuria, PKU, infectious diseases, anosmia, maternal age, Rh factor or blood incompatibility, maternal fall or accident. Perinatal causes, that is, during birth, premature delivery, umbilical cord accidents, multiple gestation, misuse of forceps, head trauma at birth, respiratory disorders, intracranial hemorrhage, neonatal seizure. C. Postnatal causes, that is, after birth, head injury, infections, toxic metabolic disorder, malnutrition, poisoning, environmental deprivation. Characteristics of persons with mental retardation. We can outline the characteristics of persons with mental retardation under the following. A. educational or intellectual characteristics. Have difficulty in remembering information. Have short attention span. Have problem in transferring knowledge. They cannot generalize. They learn very slowly. They lack interest in learning or problem solving. Computation ability is very low. B. Behavioral or emotional characteristics. Some are restless or hyperactive. Some are loners or hyperactive. Some exhibit temper tantrum. Some are easily distracted. C. Physical characteristics. Some have big or small heads. Some have big tongues. Some have stubby legs and hands. Some have golden voice. In some, it is difficult to differentiate the chest from the abdomen. Some have basal forehead. Characteristics of mental retardation. Mental retardation can be classified under the following, based on some factors such as degree of retardation, clinical symptoms, educational objectives, and causes. Old or traditional classification table. Classification: you have idiot, intelligence quotient range, IQ range. You have 0 to 25. On the classification, you have imbecile, IQ range, intelligence quotient. You have 26 to 50. Moron. On the classification, and IQ, intelligence quotient range, you have 51 to 75. Now the new or educational classification. Classification, you have total dependent mentally retarded. Intelligence quotient range, IQ range, you have 0 to 25. Classification, trainable mentally retarded. IQ range, intelligence quotient range, you have 26 to 50. On the classification, you have educable mentally retarded. Intelligence quotient range, IQ range, you have 51 to 75. British classification. Profound mental retardation, severe mental retardation, moderate mental retardation, and mild mental retardation. Clinical classification. Down syndrome, Mongols. Microcephaly, hydrocephaly, creatinines, phenylketonuria, PKU, galactosemia, fragile or X syndrome, Turner's syndrome, Klinefelter syndrome, Prader-Willi syndrome. Educational programs for persons with mental retardation. In the time past, many people believed that It is a waste of time trying to educate persons with mental retardation. Hence, they were neglected and left to their fate. The history of their education rarely started when Jane Attard worked on Victor the Wild Boy of Avern. From that period, different experts have emerged with various methods and strategies for educating persons with mental retardation. Because of the nature of their intelligence, people have advocated a separate school and environment for their education. With the time, people started advocating their integration for social interaction, and thus we have the following programs among others. A. Special school. This implies putting children with mental retardation in a school without mixing up with the regular school system. The school is specially built for them and them alone. B. Special class. This implies having a classroom meant for children with mental retardation in a regular school setting. They interact with other children in the school compound, but not learning together with them in the same classroom. C. Resource room. In this case, a resource room is built or created in the regular school where the children with mental retardation will go to be attended to during a particular time of the school hour by the resource teacher, who is a specialist in handling them. They learn together with other children in the classroom and interact with them, but a special time is created for them to visit the resource room for special attention. D. Itinerant teacher. In this case, there is a special teacher who might not be part of the regular teachers in the school, but come at a scheduled time to attend to the needs of children with mental retardation. After attending to them, he goes away until the next appointed time. E. Regular school with special unit. In this case, a special unit is constructed within the compound of the regular school. This implies interaction with other children in the same compound, but not learning together in the same classroom. F. Inclusive education. This is the most current program of education recommendation for children with exceptional needs. In this case, there is no discrimination at all against the children with exceptional needs. All categories of exceptionality are cared for together with the regular children in the same setting. Prevention of mental retardation. Prevention, as people say, is better than cure. The condition of mental retardation is very serious, and it is better prevented in our society than seeking for the cure. Several measures can be employed to prevent the incidence of mental retardation, and this include: 1. Dissemination of information about the nature, causes, and prevention of childhood accidents through mass media, workshops, and seminars is very crucial. 2. provision of food, primary healthcare services in our society is also important. 3. Expectant mothers should be enlightened on the risk of self-medication, exposure to X-ray examination, and general carefree living, which can endanger the life of the fetus. 4. Over and underage women should be advised on the danger of bringing up children. 5. Community-based genetic counseling and diagnostic centers should be provided by government and non-governmental organizations, NGOs, and be adequately patronized. 6. Excessive drug use should be curtailed or controlled, as well as the use of fake drugs outlawed or prescribed by the government. 7. Expectant mother and children should be properly fed with balanced diet to prevent malnutrition. 8. Would-be couples should be mandated to do blood compatibility tests before marriage. 9. School and home environments should be stimulating enough to make learning friendly and possible. Study session summary. In this study session, we have examined the definition of mental retardation as given by different authors. We also noted that the causes of mental retardation varies from genetic, chromosomal, and environmental factors to radiation. We as well stated that observable characteristics of persons with mental retardation ranges from physical, emotional to educational. Children with mental retardation can be educated through various educational programs according to their intelligence quotient. Mental retardation can equally be prevented in our society. That ends study session 2. Thanks for listening.